Cancer of liver is a relatively dangerous disease because of late diagnosis. The danger can be understood by a fact that it is less prevalent, less common than cancers of breast and intestine. But on the other hand, it takes more lives than these two cancers. So it is less prevalent, less common, but more deadly. It is a relatively common cancer among the commoner cancers. The data in our country are not very robust, but as per the estimates, it affects 30 to 50,000 new patients every year. The cancer of liver has many risk factors that are preventable and also treatable. It is also unique in being able to be suspected by a simple and widely available blood test. Liver, as we all know, is a big organ that lies in the upper part of the abdomen underneath the rib cage. In olden days, it was believed that life resides in liver. That is why it was called liver. It makes bile that is released into the intestine through a channel called bile duct. The bile has enzymes that digest the food. Liver is also part of our lymphatic system that protects us from various infections. So expectedly, anything wrong with liver has cascading effects on the body. Liver is one organ that can be affected by cancer originating in any part of the body. Those cancers which are coming to liver from other parts of the body are called metastatic cancers. Their treatment is given according to the site of origin and according to the nature of the original cancer. They are not liver cancers. When we say liver cancer, then we mean the cancer that has originated from liver itself. Cancer of liver is relatively common, as we just said. The reporting system in our country is not yet very strong, but still the estimates say, as we just discussed, that 30 to 50,000 new patients of liver cancer are discovered each year. Males are 4 times as commonly affected as females. The affected population is generally in 40 to 70 years age group. This cancer, as we just mentioned, is having risk factors that are preventable and are treatable also. Let us discuss the risk factors first. The most well-known risk factor for cancer of liver is cirrhosis due to any reason. Whenever there is insult or injury in liver in any form, then the process of repair involves formation of nodules. These nodules are called regenerative nodules. If the injury and the repair process is widespread in liver, in that condition sometimes the entire liver gets shrunken and the liver becomes studded with such nodules. This condition is called cirrhosis. As per the available data for our country, about 70 to 80% of all cancer cases of liver are because of cirrhosis. Cirrhosis is caused by liver injury mostly because of hepatitis B or hepatitis C infection. Consumption of alcohol also causes liver injuries, and these liver injuries, when healed, can take the form of cirrhosis. In our country, hepatitis B is responsible for majority of the cases of liver cirrhosis. Infection of hepatitis B is contracted by infected needles, by infected blood products, or from infected sexual partner. Vertical infection from mother to a child in womb is also present. Hepatitis B, the most common risk factor, fortunately, is a vaccine preventable disease. Hepatitis C is another illness that is similar to hepatitis B in its transmission. It is responsible for about 15% of cancer cases of liver. It is treatable with freely available and relatively inexpensive treatment and simple oral treatment. Hepatitis infection is widely prevalent and it has multiple problems, so we shall discuss hepatitis infection in detail in a separate dedicated video, but here we shall remain focused on liver cancer. The risk factors for liver cancer in addition to hepatitis and alcohol are obesity, diabetes, and some conditions known as non-alcoholic liver diseases that affect the people who do not consume alcohol. Having discussed the risk factors, let us now move on to the science of this deadly disease. Generally, the liver cancer is detected late in its natural course. The reasons are quite similar to the reasons for late detection of gallbladder cancer we discussed in a previous video. The big reason is that liver lies inside the abdomen. It is not visible from outside. So anything wrong going on is not known to the person affected. One more reason is that liver has been given a lot of reserve by Almighty. So a large part of liver is damaged, but the person does not have any problem. By the time the symptoms come, it is already quite late. The patients generally present with a palpable mass in the upper abdomen. This mass can be big, sometimes as big as a middle-sized coconut. The patients might present because of liver failure and the form of fluid in abdomen, maybe with jaundice or maybe without jaundice. Once any of the signals is present and there is suspicion of presence of cancer of liver, then the basic next test is ultrasound of abdomen. As we have discussed it multiple times, ultrasound is one test which is very simple, very cost effective, and is available freely across the country, even in small townships. So the ultrasound examination will tell us whether there is actually any mass present. It will also tell us the size and the numbers. One freely available blood test is alpha fetoprotein, or simply AFP. This test is very simple. It is done from blood. Today, all big chain of laboratories, they have collection centers in small townships also. Diagnosis, as in other cancers, is confirmed by either a fine needle aspiration or a guided biopsy under ultrasound guidance. However, in case of liver cancer, there is a problem that if liver which is not functioning normally might bleed if a biopsy is taken. So in many situations, biopsy is avoided because of the risk of bleeding, and treatment is started. When we say treatment, then the curative treatment, the treatment that can eradicate this cancer from the body, is surgery. Surgery might be in the form of removal of a part of liver, or in selected cases in the form of liver transplant. Many a times, if the tumor is big, the blood vessels supplying the tumor might have to be blocked by embolization with chemotherapy. This embolization, this blockage of the blood vessel, will lead to shrinkage of the tumor. This shrinkage will make the surgery easier for the surgical team and less problematic for the patient also. Many times there are patients who have a small tumor, a single tumor or a treatable tumor, but they are unfit for surgery, or tumor is present in inaccessible location. In that condition, the tumor is destroyed in situ by a technique known as radiofrequency ablation, or simply RFA. Once the disease is advanced, it is no longer suitable for surgery. In that conditions, patients are treated with targeted medicines in the form of oral treatment or in the form of injectable treatment. Antiviral treatment for hepatitis infection goes on alongside the treatment of cancer. These antivirals, they will halt, they will arrest the further damages because of the viral proliferation, and will also improve liver function. As in any other cancer, the results of advanced cancer are not that good. But still, these targeted treatments, they provide some quality life to the patient, some time they can have with their families. We realize that liver cancer is a deadly cancer and it is preventable to a large extent. So let us see how we can prevent it. Getting the entire family vaccinated against hepatitis B. Getting the hepatitis B or C infection treated as early as possible if detected. Cessation of alcohol. These three steps, they go a long way in preventing cirrhosis and subsequent formation of cancer. These are very simple ways, and they can help us in preventing loss of precious life from this deadly disease. With all this, I wish all cancer patients a speedy recovery and all of you a very healthy life. Thank you.